Good morning, good afternoon, and good evening, wherever you may be. My name is Sarah Jane Demy of Demy-Colton, and I'm located in New York City. And on behalf of the Demy-Colton team, our sponsors and supporters, and all of our speakers and panelists, it's my pleasure to welcome you to the 19th installment of the Demy-Colton Virtual Salon Series, which will focus on VC trends in healthcare investing. And I am sure this is going to be a really, really great discussion. As some of you know, Demy-Colton's mission is all about convening healthcare industry leaders from multiple disciplines to catalyze change. At this time last year, we were about to convene people in New York City to launch a new conference called BioFuture. When COVID changed our plans, and I'm sure it changed your plans as well. So we pivoted and launched the Demy-Colton Virtual Salon Series to continue to bring people together with pertinent and important information. As we are starting to get back to our new normal, however, we know that the Virtual Salon Series will be here to stay. And I invite all of you to check our website for the schedule of upcoming salons. I encourage you to join our virtual events. And moreover, I encourage you to join us at our in-person event, BioFuture, which will have a virtual component. And it's now scheduled to take place here in New York City, October 5 and 6, and we hope to see you there. Before we get underway, I do want to thank all of our virtual salon sponsors and BioFuture's founding sponsors for their ongoing and continued support. Without them, this would really not be possible. Now let's shift to the structure of today's program. This formal portion of the discussion will last approximately 50 minutes, and it will be followed by a 15-minute Q&A session. You can submit your questions in the Ask a Question pane below the screen, and we will address as many as possible. I do encourage you all to make your questions as succinct as possible. That will enable us to ask more questions. And please note that today's salon will be recorded and it will be available for on-demand viewing later today. And any additional materials that are provided with the salon can be viewed in the Event Resources tab. Now to today's salon. VC Trends in Healthcare Investing, the Power of Convergence. We have a great moderator and great panelists who think outside the box, and we're really happy that they're here with us today. Our moderator is Kimberly Ha. She is CEO and founder of KKH Advisors, a strategic advisory firm. And she's also a former journalist and a really, really great PR person. Our panelists include Ann DeWitt, a general partner of The Engine out of MIT, Alex Morgan, a partner at Koshler Ventures, and Benjamin Quiroga, a general partner at Humboldt Fund. Without further ado, I'd like to turn the virtual podium over to Kimberly. So Kimberly, the stage is yours.
Thanks, Sarah, and thanks everyone for joining our virtual salon today. Really excited to kick off this panel discussion, but I guess first question is hopefully an easy one for some of the audience members, who haven't heard of, Convergence in biotech. I guess to start, off with this first question, what is Convergence in biotech? And can you all kind of give some examples of companies you've invested in recently that, embody convergence?
Great, maybe I'll start off, Kimberly, if that sounds good. So yeah, convergence, we think about that as, multiple disciplines and people representing those knowledge coming together to solve important problems, like across all the problems we have in the globe, whether human health, climate change, et cetera. And I think the specific for biotech, it's really how do we converge what's happening, our knowledge base in the world of biology, the world of disease, the world of plants, and how do we intersect that with what's happening in the world of physics, chemistry, materials to solve important problems that we have. And I'm sure we'll talk more about Celino team, so I'll leave that one aside. But maybe to give an additional example would be a company, Vaxxus, that we invested in, where it's really a novel material inside of an engineered form to give rise to new types of ways we can vaccinate and have better efficacy with our vaccines and have those show up to our doorstep. And so requiring expertise in a material, expertise in sort of engineering of a certain type of microneedle, as well as understanding the immunology and biology of vaccination. And that team really bringing that all together to create a new type of product we haven't seen before, even exemplified in the world that we're living here, that we're all virtual. So those would be a couple things on my end.
Yeah, we did a historical review and couldn't find the major drivers of revolutions within industries have pretty much all come external to that industry. It's not just biotech, right? So, field like archaeology, looking at old things, significant innovation there has been driven by techniques such as infrared imaging from planes, magnetometry, measuring what's in the soil, techniques in radiocarbon dating. And you look at fields like communications, the significant disruptions there recently have come from battery development. So chemistry creating the batteries that enable the mobile phone infrastructure. And now mobile, of course, has disrupted industries like transportation with how we think about, movement in the city and just integration there. But of course, now we have that as a wonderful tool for electronic patient-reported outcomes in clinical trials, which hopefully will disrupt currently the very expensive and unwieldy process of clinical trials. So I think in biology, historically, innovation in medicine has come from outside. So Francis Crick was a physicist by training. The person responsible for the structure of DNA and the genetic code didn't train as a biologist, right? In medicine and healthcare, techniques such as ultrasound, right? That was developed by the Navy for sonar. Now it's used, of course, in many areas of medicine. MRI came out of NMR, physical chemistry. Much of the innovation in healthcare is coming now in data, and as historically, it's come from areas like material science. So example companies that I think sort of embody this that we're active in is Anne mentioned Celino, and that's a great one because that's a convergence of lasers, AI, stem cell biology all in one. So there's sort of like a triple word score for exciting fields. But another example would be a company called Kernel that we're invested in down in LA, and they're doing functional brain monitoring. But the techniques that they use come out of two different disciplines. One, a lot of the infrared measurement modalities that were developed or are actively being developed for autonomous vehicle sensing, as well as atomic magnetometry that was used in very sensitive physics experiments. And that's being used to basically probe the functional activity of a brain. So there's most of the innovation that we do or we try to do is looking outside of the fields that we're trying to make significant advancements and strides in.
Great. Thanks, Alex. And Benjamin, I guess you founded Humble Fund last year. Can you tell and I think Convergence is a core kind of key investment, a pillar for Humble. Can you tell our audience a bit about Humble Fund and kind of the companies you're looking at and investing in? Sure.
So we at Humble, we are three partners with different backgrounds. Myself, I had a background in business. I am from Latin America, so I'm being exposed. I'm being involved in agriculture, the protein industry or animal agriculture, if I call it that way. Our other partner, Sebastian, he's a PhD from UCSF, so he had a network and a background in science, biology, and another partner, is Francisco, who has a background in business, mostly in the US. And the cool thing about it is that I think biology will be a source of innovation in the coming future, a really important source of innovation, and that is due to the insight of biology that we have now because of the increasing amount of data, the tools to gather and catch the data, and the capabilities that we're developing. So I think now biology is not a black box anymore. So we can understand biology in a deeper way. So we can guide biology in our benefit. And I think that is what we are trying to do, mostly in alternative food companies or in agriculture and in the pharma sector. And I think this kind of revolution will have an impact across the board. So I don't think this is something bound to the pharma sector. I think it will be also impacting agriculture, food, materials, and many other industries. And so we at Humble, we invest in platform technologies with high optionality and with applications in those areas. So that's more or less what we're doing. And I think this convergence that we are describing is what we need in order to this kind of revolution to being successful and bringing together different backgrounds, different industries. One company that we were really excited about it, and I think it's not. And it is an example of not a convergence of techniques, but a convergence of uses. It's a company that we invested called Mirable. That is a company working on cell-based meat or clean meat. So that company is using the underlying technology of that company it was developed by a company called Bio, and that is a cell therapy company. So you have those two industries, so food and the healthcare sector, using the same underlying technology to solve a same challenge or a shared challenge, which is developing cells or producing cells in a scalable and efficient way. And I think that is pretty interesting. So I think that will reinforce or this convergence approach.
Thanks, Benjamin. And I guess on the topic of scaling cells, one company that you all kind of mentioned is Celino. And I think, Anne, on another call, we were kind of discussing this. Like, it's kind of interesting how all three of you, how did you find this company, and also what was attractive about Celino that made you want to invest?
Thanks, Kimberly, for letting us really dive in here, since all three of us know the team. Yeah, we've all invested, and I think this will be really fun because we all kind of met this team at different points, and we're all working together with Nabiha, Matthias, Marina, and the team as they're building their company. So in the early days, we met this team of founders, really unique, caught our attention. It was sort of like a joke. It's like a CEO running an optics company meets a couple physicists in a stem cell biology, and they walk into the bar. Like it's almost it's amazing, how by experience and by discipline and knowledge base, how different the founding team. So I'd say right away that struck us, and also the kind of the big problem that they were going after, which is regenerative medicines hold so much promise, yet they're really prohibitive by cost and manufacturing. Like, we really just can't explore what the possibilities are in this domain. So how do we think about solving that problem? And we have a starting point with the work that we've done at Harvard, but that may or may not be the best approach, but let's go after that problem. So I think, that multidisciplinary team, the focus on a big problem, and then also the way that team made decisions together, even in the earliest days when we met them and they were looking for space. And it was like, well, could you use some money to actually start this company? It's like, yeah, well, we can use some money. It's like, great, let's do that. So that was some of the things we noticed in the very early days of as those founders were getting the company up and going.
It's maybe worth mentioning, describing what they do in maybe in greater detail. I think if anybody listening remembers from the history of computer science, maybe high school, hearing about the Jacquard loom, which was sort of one of the first programmable piece of hardware. It's similar to that. So you can program in what organization of individual cells that you would like in collection together, and they optically, in an AI-guided fashion, basically guide cell fate and can deliver payloads to individual cells in 2D structures. So think about printing whatever, their motto or their goal is any cell for any person. So if you need a cell or a set of tissues, eventually they'll be able to have an autonomous system spin it up. You say, this is the design that I want, and they'll create it for you. So, of course, right now they're working on some very simple things, such as creating very cheap, on-demand autologous stem cells. So one of the big barriers for a lot of cell therapies is the cost of development and getting the handcrafting that you need to do to create an autologous iPS cell line. They're doing that in a basically push-button way. So you'll have a box. You can maybe do a cheek swab or blood draw. You stick a sample in, and you'll get autologous iPSCs out, hopefully at volume.
Sure. One thing I also want to add is, for us, another thing, apart from the things that already been said, that it was the fact that they have a huge potential in hand, and they were able to draw a pathway forward in terms of how they're going to build their platform. So they first are going for some easy or no, the first indication, the first application, but they're going to build the platform from there, and the potential that this platform has is huge. And the things that it can enable with this is also huge. So, and the way they're thinking about it is pretty interesting. And they're pretty humble. They understand where they stand, and they're going to work pretty strong on building the platform and really take all the value or try to create much value as they can around this platform. And that's something that I think is really interesting, because I think one of the huge challenge that most of these founders with this amazing platform technologies has is try to define what will be the path forward in terms of how they build the platform and how they define which indications or applications they're gonna go for. They wanna go after.
Yeah, and I just on those two, I always really liked sort of their approach of, hey, in the semiconductor industry, we can print out these integrated circuits like really at a massive scale. And so we have these things that are called foundries in the world of semiconductors that are just cranking chips, mega volumes, really small, complicated parts. And the thought of, hey, like, we know what that looks like in the semiconductor foundry business. Why can't we think about what does it take to create a tissue foundry? So how can we make those cell sheets, tissues, and starting with the autologous cells, how can we do that like we make and crank chips and integrated circuits in the semiconductor industry? And what's it going to take in terms of the box, the inputs, the machine learning in order to make that, as Alex was saying, in the push button style, and then to plot that path, as Benjamin was saying, like, because they have it, they look at that other industry and they can walk over, hey, okay, so that's what that means that we need to do, and here's how we build it, and here's the plan, and here's the capital. So, it really.
Nabia may be the next Henry Ford of cells.
And I think to add, it's interesting because she's also a physicist. So, it's interesting because, she's tackling such a huge, the company's tackling such a huge problem in biology right now. But, majority of the team, they're engineers, they're AI machine learning scientists, they're engineers, they're physicists. So I think that's really fascinating as well. Thanks. So I guess switching gears for a bit, what are some of the most interesting pitches that you've received, and how much of, in terms of the deal sourcing, is, like inbound companies pitching you versus, your team kind of going out and, unfortunately not in-person conferences anymore, but, going out and kind of like sourcing deals? And I think we've got a number of questions sort of from the audience in terms of, how do I find investors if I'm working on a startup, and, what venue should I kind of attend?
Yeah, cool. Maybe I'll take the second one, and either Benjamin or Alex did pick on the other ones. Maybe in terms of kind of the sourcing, we talk about it like sourcing and hunting. Kind of two different sides is how kind of we describe it. Like there's kind of the inflow, kind of the passive, and then there's what we would call like the hunting. Like there are areas that you're running down, bodies of work that we're following. And so I'd say we find that it's important to do both sort of what's coming in as well as kind of hunting. And I think that's in part because of at the Engine, we are very focused on the commercialization of breakthroughs, by and large, that are originated inside the academic institution. And how do we pull those innovations and those breakthroughs in science and engineering? How do we pull those forward into commercialization? So that kind of hunting activity of where is like the bleeding edge of academia, what types of new breakthroughs are happening in the physics department, chemistry department, how might they walk over, and where are the future founders who are doing that work? Why are they doing that work? What problems do they find compelling for the work that they're doing? So that's kind of a big part. But I think it's also important to, as I think we all do, like we run programming, we're investors, we're kind of out in the world, and so that people know us. And then when they think they've got something that kind of fits with what we can do as both investors and supporters of the company, that people are able to find us pretty readily, because we're out, being active in the startup community and the founder communities through our own investment work, but also through other things that we're all doing in addition.
So for the last question you had, how do people find investors? So you can go to our website, coastventures.com, and there's a link where you can submit a deck. And we look at that. So Vinod Khosla spends a lot of time actually just going through our inbound. We have a team that just looks at all the decks that are sent in. So there's certainly that way. I think you can just reach out to investors. They're looking for good companies. You want to be very concise in whatever you send them, and very clear for two reasons. One is investors are very busy people, and so you don't want to send these very long, complicated things where you have to do all this. You have to do a lot of work to understand the key message. You want to be very concise. It also shows clear thinking, like you understand what you're doing and why. But if you're not, investors, that's their job, is early stage and venture capital investors, is to look at ideas and teams and so forth and evaluate them. So you can just reach out. I would say for us, it's the kind of in answer to the previous questions, it's a blended mix. So there are some companies in our portfolio like Mervi, which is working in fetal maternal health. I think it's a big area. That's because I attended a scientific talk and I said, this is an area that's really interesting. Steve Quake's got some great technology here. Let's do something with them. And it's a lot of work to do company creation. And Inflamatics is another one where I knew the founders and said, you guys should start a company. And Tim Sweeney has turned out to be an amazing entrepreneur in the diagnostic space. Others, of course, some people send in a pitch, but it's a mix. Or we get an introduction by another investor and they say, we have a cool company that we think you should look at.
Sure. I think from our side, we're pretty new. We're a new fund, so we are exploring the whole time. We're reaching out people, reaching out labs, and reaching out a PhD student in certain areas that we think that we're interested about it. And so we'll try to be all over the places, looking for new things. We're pretty open to hear new things, like sometimes crazy things, but we try to hear almost everything that comes to our website or comes to our emails, and we're constantly looking for things outside. Yeah.
I mean, yeah. So go ahead.
Sorry to interrupt. And one last thing. I think I think one good thing about COVID could be that now everything is virtual. So reach out and set up a meeting, a call is pretty easy for us, and that's it's a good thing for us too. Yeah.
Right. So, I mean, I think that was kind of, to myself, like it's the fact that you launched the fund last year during a pandemic and the team's been able to invest in like over 20 something companies. How important is, now we can't meet people in person, unfortunately, but, previously it's sort of like, investing in a startup without meeting the CEO or the team, to kind of get a sense of just the team dynamic. Like, how important is that? And, how did you make your investment decisions kind of like, just meeting the team virtually? I'm just kind of curious about that. I mean, it was such a big year. I mean, it was kind of crazy that it was like so many companies. And then, just from the portfolio, it's like one of the companies already did an IPO. But so
Yeah, even though we started the fund a year ago or a little bit more, we have been working together for almost 3 years, and we have been investing in the space before. So we took that network and invested, and we thought that 2020 was a opportunity for us, because almost every company was raising capital, and we took that opportunity. So to develop the platform and to develop the network for sure. And in terms of how we get along with the founders, I think we have a pretty close relationship with them. We I don't know, we set up WhatsApp groups and talk with them. I don't know, we haven't been a challenge for us in that sense.
We have a company. We have a company, Partis Bio, that has developed basically a small molecule drug for that's pan coronavirus. So it's a protease inhibitor that should work for the current SARS-CoV-2 epidemic, as well as future coronaviruses as a treatment, either post-exposure prophylaxis or direct treatment. And that company was created after the start of the pandemic, for obvious reasons, by a very smart and motivated team. We invested early, and they've made a tremendous amount of progress in a very short period, and all with a team that I have never met. And a company that was founded after the start of the pandemic. So I think we've invested in several companies, and many of them are doing amazingly well in a very short period of time.
That's great. This was actually an incoming audience question. What are we doing well in applying AI, machine learning in life sciences? And can you share a specific example? Where are we falling short in terms of applying AI in life sciences?
Maybe I'll jump in and if you have comments.
Yeah, I'll just give my 2 cents. So number one, great, we're finally doing it. So number one, I'd say at least we've gotten off the starting blocks. My view is that we're still really early in understanding what it can really do in the sort of broad scope of life sciences. I think part of that is, again, it's sort of what are the types of problems and what are the teams that can really deal with these AI next to biology, next side to maybe clinical if it's in the pharma world, or next to farmers, next to equipment manufacturers. It's like those are, so I think that's part of it, is it's a change in kind of even the early product development workflow, for example, or services workflow, and how does that really get incorporated, how to get people understanding enough that they can work across their disciplines. So one, we've started. Two, it's early days. I think we've got some companies who have figured out how to put those pieces together, but I just think that there's a bunch more to come. So we just got to keep figuring out in those teams, figuring out how to work together and how to really go after product or service opportunities in a way that takes advantage of sets of tools that we just haven't seen them before. So. But Alex, you've made a number of sort of investments.
I spent some time as an AI researcher, and this is what my PhD was on. So we're pretty active in the space. But I would say in a lot of areas, AI is already demonstrating or able to create superhuman level performance. So a lot of things in pattern classification or pattern finding. So image recognition interpretation is a great example. So I think AI systems are dominating areas like histology. You want to have a human in the loop for a lot of the applications. But for an EKG, machines can extract far more information than a human can. A human, a very, very good cardiologist can extract some information, but a machine can, or our company AliveCore, for example, and they're in collaboration with Mayo and other groups, you can extract all kinds of things, gender, age, you can get a serum potassium level. So not just that serum potassium is high or low, but an actual number from an EKG. If you have an image of a retina, machines can extract far more information than even the best ophthalmologist can do right now. So there are lots of areas. There are some challenges in protein folding, right? We've made huge progress in the last couple of years, and not through physics and physical simulation, but through AI. a lot of it is an implementation integration and mixed incentives. So in a lot of deployed areas of healthcare, there aren't necessarily incentives historically in how things have been positioned. Machines can predict lots of things about healthcare trajectories, and there's been unfortunately I think it's almost a human rights catastrophe that these technologies are not being more widely deployed. We have companies like Ellipsis that can detect your mental state and depression, and if things are getting worse for you, from voice. We have lots of efforts in healthcare analytics that can detect progression to kidney failure, but there just aren't necessarily incentives, because once you're on dialysis, you can do a lot of billing. And so I think we're changing, and as incentives and payment structures change, but I think a lot of it in certainly on the deployed healthcare side has been mixed incentives, challenges in data sharing, all kinds of things, as opposed to technical issues. Because a lot of these things are, AI colonoscopy, for example, right? I mean, why would you not want an AI system making sure that the gastroenterologist isn't missing a polyp? We have a company, DocBot, doing that.
Just from my side, I don't have an expert in AI, but most of the companies that we invested, I think across the board, all of them use AI in a certain way to understand biology, and I think that is something that we should expect to see more and more, and going into different areas. So I think this should go in different applications. So the amount of data that we will be gathering for in those applications will be expanding, and therefore we will have a better insight. But I think. Sorry, go ahead.
No, please.
No, I'm just saying that this is how the good thing about this convergence that is kind of compounding with new applications that coming in. Right?
Yeah, we're in an age actually of ubiquitous AI that I don't think a lot of people realize. So, you take out your phone and you look at a map. AI is actually determining which text you see, because you have to decide at different scales of resolution, zooming in and out, you should place some amount of text, and you have to decide which to display to a person so that it's not just crowded with text, because there are labels on all kinds of objects. Pretty much anything that you see online, you go to Pinterest, that's an AI company deciding which images to show. Where all kinds of AI is around us all the time, and it's operational, functional, and in some sense essential now to the operation of a lot of people's lives. Any content that you see, whether it's Amazon, Netflix, etc., it's AI behind it right now. And a lot of financial transactions, a lot of hedge funds, quant hedge funds, a lot of trading is being done algorithmically driven by very good AI teams.
Great. Thanks, Alex. I mean, on that topic, another incoming question was, large tech companies, Apple, Google, Amazon, are moving into healthcare. Do you see them trying to compete with large pharma in drug discovery and development?
So I think it's well known that there's some examples of the largest tech companies moving into that. Certainly Google and Verily have a number of publicly known forays into that, and oftentimes in collaboration with big pharma. For example, both Novartis and with Sanofi and Verily, a number of relationships, Sanofi in the diabetes space. So I think that's already happening and has been happening for a number of years. I think that there's a lot where that relationship makes a bunch of sense, and I think even now we're seeing from the big pharma side that the incorporation of technology into the pharma companies, which a decade ago I would argue there was very minimal sort of focus on that, like at a board and CEO level. I think we've really seen that on the pharma side, like ramp up significantly. And even some of the slowest of the pharmas to adopt are now fully there, like at the board level, at the CEO level, and this is imperative. We've also seen the like with quantum computing, for example. So just to kind of stick a pin on, how far we're going with some of those groups, even venturing into the space of quantum computing, obviously in partnership. So I think we'll continue to see more of that, and how that starts creating that blur between the big tech companies and the pharma. I think we're going to continue to see that blur, and whether or not Google or Microsoft becomes a FIPCO, fully integrated pharma, we'll see. But I'm not so sure that the pharma is going to look the same in the future as how we think about that business today.
I think Google, for example, is not incentivized to leverage many of the secrets and data that they have access to in sort of the full extent. So, for example, if Google wanted to be a quant hedge fund, they have access to all kinds of very valuable information, from where people go, what businesses are being frequented. They control Gmail, for example. And so they're really disincentivized, though, from using that information in certain ways, because that would people just wouldn't want to use the platform. Where I've seen a lot of the interest in biotech is in tooling as a function of trying to support some of their other key lines of business. So a lot of the big players think that the cloud, there's not a single dominant player. It's not a concluded battle for cloud compute. And so they're creating a lot of the development they've done is really to demonstrate what is possible with cloud compute. And I think they're going to create infrastructure for many pharma or small biotechs to use. And I think that's great for the whole industry. I think currently a lot of pharma companies are evolving into distribution channels, and they're outsourcing a lot of their innovation through M&A. And so that's, a lot of the new innovations happening in smaller companies. So I think there's sort of like a mix of incentives that I don't think people thinking about, coming up with the new therapies, you should look to necessarily Google or even big pharma to do. You should look for small companies creating innovative new modalities. And then this is tooling and infrastructure to make it easier to do. And then distribution channels.
Benjamin, do you have anything to add to that? Or?
No, I totally agree with Alex. I think most of the tools of the innovation that these big names have developed are being used by the small startup in the biotech world, and in a way that they are already in. But I don't see them going after pursuing a fully integrated company in the biotech space. I think I agree with that. Maybe startups or the traditional pharma are the ones better suited for developing a new therapy.
I think where pharma is interested in what Google and other these companies and Facebook do better is actually engage and communicate with their customers. I think traditional pharma has really not had a direct line of communication. And if we're entering an age where for very expensive therapies like cell therapies, the groups that develop them are seeking very significant payments, hundreds of thousands of dollars for treatment, will need to show out. They will need to show outcomes and track patients over time, as well as a lot of incentives to increase utilization of therapeutics, which means channel and customer experience, all kinds of things. I think one of the other aspect is that tech companies are really good at is basically customer experience, an area where healthcare is terrible at. And I think as the rise of telemedicine and COVID has moved a lot of things online, it'll increase competition in healthcare services. And actually, I think the net will be, the net outcome will be hopefully much better customer experience, because you're moving away from geographic monopolies that providers have in their catchment areas.
Time is really flying on this panel, but what do you see as the biggest growth opportunities in life sciences using Convergence? I guess, what are some areas, within life sciences or biotech that you guys have your eye on right now?
You want me to take it? I can say growth could come. I think it could come from those areas where biology have been in the sidelines. I think in a certain way. But I think food for food tech, for example, it could be a huge opportunity for these life science tools, and for sure it could be also the agriculture. But I think those two industries, because biology haven't been a source of innovation in those two industries, I think, and now I think it will be. I think that is a huge opportunity for growth. But for sure, I think in terms of impact, healthcare is the main one. Right? In terms of health, how you can impact health, and you have to look at the COVID vaccines to answer that question in that sense. Yeah.
Mm-hmm.
Yeah, I think there's a lot of interesting opportunities. One of the great powers of AI is to not just augment human behavior, but create scalable technology that in the past you might have thrown human labor at. If you can do that with software, you can scale much faster and much cheaper and increase access to high quality judgments or pattern finding or whatever. A lot of healthcare is actually pattern identification and then saying, okay, this is the class of problem that you have, and this is the path of treatment that I want you to be on. And so I think by increasing access, AI will increase access to the top quality judgments and guidance there. I think we're very interested in channels of distribution and data collection. So mobile, things moving online, create instrumented channels of communication and data collection, which create a lot of opportunities. Certainly one of the interesting innovations in therapeutics in the last few years has been essentially the programmability of therapeutics. RNA therapeutics, has just arrived with Spinraza at first, and now, Moderna and Pfizer are saving the world with RNA. But that makes a medication which is programmable. It's information. You're sending in a little code of RNA, and the targets are actually RNA themselves. And so we have a company, Deep Genomics, which is basically an AI company doing drug development. CRISPR, guide RNA, it's programmable. You're sending in a drug, which is information. Gene therapies, again, there've been a lot of struggles and challenges in that field, but a lot of advancements being done. So we're in the age of programmable therapeutics, where the targets and the drugs are information. Certainly with nutraceuticals, digital therapeutics, electroceuticals, we'll be in an age where information is a drug, which is super interesting and super scalable, hopefully.
Yeah. Yeah, I think I would second a lot of what Benjamin and Alex said. I think if I think about what are some of the problem areas that I hope convergent approaches will attack, and we will do a much better job. I think I agree on the food side. I fully agree on what I would call the manufacturing side. I think two other areas that maybe I would add would be one that Alex noted, kernel. It's our understanding of the brain and as tied to neurological based diseases, we have hardly made any progress there. So I would hope with convergent approaches, if we use that as a going after a problem, I would hope we really make major headway in how we handle the brain health, neurodegenerative diseases, and other neurological diseases. I think the other big one that I would add, in addition to kind of food, manufacturing, brain, would be community health. And that's kind of the bucket that I would also put a lot of these into. We've kind of had this weird element of personalization and one by one, patient by patient. But at a societal level, it's community health. So how do we, vaccination it's a community phenomenon. Wastewater treatment as a way to monitor what's happening is really powerful to understand what's happening in the community. Is there opioid overdose? So I'd also hope that we've got convergent approaches that are really tackling what I would call communities, whether it's community health or other aspects of community, our cities, mobility, how we live, how we eat, food is available, freshness of food is available in communities. So I think we've got a lot of exciting problems that we can really go after with teams that are willing to be multidisciplinary, bring those disciplines together and go after some of these big problems we still have hanging out there.
Great, thanks so much, everyone. Another audience question, maybe for Alex, because you mentioned diagnostics. What is the VC appetite for investing in diagnostics? Has your fund invested in any diagnostics companies, liquid biopsies, et cetera?
Yeah, we've done a ton of investing. So Color Genomics, which is doing a lot of has been doing a lot of the COVID testing in the West Coast, in California. Opentrons, which is doing a significant amount. That's a lab robotics company, but they're using their expertise in lab robotics and automation and liquid handling to scale up COVID testing in New York. They're doing a significant amount of testing in the New York area. We've done Guardant Health, which was basically one of the first, or maybe the first, company in the liquid biopsy space in the current generation of how we think about liquid biopsy. Was a seed investment of ours, and they're doing a lot of interesting things, of course. Informatics that I mentioned, they're doing point of care RNA profiling for understanding how the immune system is reacting. Carius, which is doing cell-free DNA for infectious disease purposes. Just a lot of companies, Genelite, Scifox, many companies in diagnostics. Certainly, I think COVID has changed diagnostics dramatically. If you had a thermocycler in a CLIA-approved lab a year ago, you could make a lot of money over the past year. Some of that income is going to probably be transient, but it has shown the value of and the scalability of diagnostics. A lot of tech dev has happened, making point-of-care diagnostics cheaper. So there's a lot of activity in the space. We have a company, DiscernDx, which is multi-omics liquid biopsy for everything except cancer. And they're looking at proteomics, metabolomics, epigenetic profiling in a blood sample. So there's just lots of opportunity there.
I guess before we go to live Q&A, what advice do you have for early stage pre-seed companies? What steps or due diligence needs to be done? I guess for some audience members that are starting their own startup and they're even in the earlier pre-stage. And Alex, to your point of the pitch deck and just presenting the company properly, I guess what advice would you have? Like, have there been just pitch decks that were just disastrous that you were like, okay, I'm definitely not investing in? And I guess what red flags and warning signs versus how can startup founders best position themselves when they're approaching VCs like yourself?
Well, if you're directing it to me, as I said, I think one of the key things is being concise about your vision and being straightforward and honest about how you think about the company and the team and what the challenges are. The team should know the reasons to invest and the reasons not to invest, and be very clear with your investor about those. What is not good and what, because no startup in this pre-seed stage is fully baked, right? That's by definition, it's in the pre-seed stage. It's kind of very nascent. It's like a little seedling. And so there are a lot of challenges, and the team should be very clear about what they are, what they have, and what they need to do to succeed. And there are companies who are in the deep tech space where the deck has been terrible, but we have still invested. I think if you're a more consumer-oriented company, you sort of have to nail that, I think, to be compelling. But it's every investor probably will say the same thing. They're looking for a great team with a differentiated product, idealism, protectability around it addressing a large problem or in a large space. And then it's just a matter of personal taste, I think, and individual thinking about how you evaluate those aspects.
I think honestly, what's interesting about just all three of your different VC funds is the fact that you're willing to take a chance on first-time founders. And, unfortunately, I think a lot of the, what we kind of call traditional biotech funds or biotech VC funds, they are, honestly, some of them are pretty ageist and pretty, they're like, oh, a biotech CEO, fits a certain profile. But I think it's honestly really cool that, all the different founders in your portfolio companies, are kind of breaking that mold. And it's kind of ironic that like in tech, right, the younger the CEO, they're going to get points for that. But then in biotech, it's the reverse, people, not you guys, but like the traditional biotech VCs, not naming them, but, they, you kind of have to have, exited or IPO'd a company. And then, I feel like it's the same, group of executives that are, it's kind of circular. Like they're going to put somebody from their VC fund to be the CEO. And then it's kind of like, the same thing over and over again. So.
Yeah. I think we probably have to be, think about, biotech to me is sort of one thing versus I'd say sort of biotherapeutics or biopharma. And so I think part of that is like, what's the company? And I would argue, biotherapeutics as a category, it was not an investable space even 15 years ago. It was like, it's never going to get there. Like biotech from a biotherapeutic standpoint wasn't going to get there. But clearly here we are today, and it's one of the most invested spaces because a whole bunch of things changed to put it into the zone of venture capital. And so now there's the playbook of being a biotherapeutics company, known set of investors. We're so good at that all those investors are lined up from a capitalization standpoint. Everybody knows the C, the Series A, the B, the mezzanine round, and into the public markets. Like we know that didn't exist a while ago. So I think that if you're running a known playbook, and we have a heavy regulatory, path where the experience, I'd say, matters because you're running a known playbook with a heavy regulatory framework that needs navigating. Experience, I'd say, is worth a lot because it's a known playbook that you're running. I think in the areas of, let's say, the broader definition of biotech, where you're trying to figure out what is the playbook for the company. Is this something new? Is this something traditional? Are there other options for like what the business is, how to create value? Then I think, being unencumbered by running a playbook a number of times is very useful to building that company. So I think we got to be a little in the weeds of what is the company trying to be built. And what are the experiences or viewpoints that are needed or not to like build that company, or thinking about, are we building something new that the world hasn't seen before? And how much experience do we need around the table?
That totally makes sense. I see Sarah. Sarah, do we still have time or?
We have time. The Q&A period will go on until about a quarter after. So we do have time, and we have a number of questions that have come in. So for those of you, our viewers who have to leave, I do want to say thank you to all of our panelists today. Thank you, Kimberly, Alex, Benjamin, and Anne. We will continue right now with Q&A. The first, not a question, but a comment, it came from one of our audience members who said, this was a fantastic panel. Thank you so much for bringing them together. So thank you, all of you, for participating. And we do have a number of questions. I'll start with one that is kind of near and dear to my heart because we are launching the meeting in New York City called BioFuture. One of our viewers, states that New York City lags behind Boston and Cambridge and the Bay Area as a destination for many life sciences companies. When you consider the medical centers that are located here, NYU, Weill Cornell, Rockefeller, Sinai, as well as the tech presence, are there areas such as synthetic bio where New York City could actually become the cluster destination for companies that work within a subcluster? What do you guys think about New York City as a destination? I see you shaking your head. Yes, Alex. So you're saying yes, New York City will be a big destination.
Opentrons, the company that I just mentioned, is in New York City. We've got a number, a SWORD, which is musculoskeletal health. It's not synthetic biology, but that's another company that's in New York. I think one of the things the pandemic has certainly changed, though, is that you can have distributed work, and there are people that can operate in a number of places. We have a company, GitLab, which is fully distributed, and they actually create a lot of content about how to create a fully distributed company. It's easier to do, of course, in software than it is when you have a physical lab and lab infrastructure. But Opentrons, is in New York. They've gotten a huge amount of lift by collaborating with experts in genomics and diagnostics in the New York ecosystem. So, Rockefeller's a great institution. The godmother of my godchildren is a faculty member there, so I like to look at technology from there. Eligo, a company we have in Paris, actually some of the technology comes out of Rockefeller. So there's, I think, a lot of breaking down of boundaries, a lot of opportunity to recruit from around the world and build strong companies anywhere. I do think one of the challenges exciting companies have in growth is, as they scale, they need to hire experienced middle management. I think, to Anne's point, sometimes when you get into the stage of the company that you're going through a regulated process, et cetera, you'd need to have infrastructure around to support that and the ability to recruit. There are subtle things around different geographies. We were talking about this actually in the presenters before the public session about infrastructure in different geographies. Is there the legal infrastructure? How does tax law affect early company creation, founder equity, and a bunch of different things. But New York's a great place, a lot of smart people, high density of smart people interacting. Nassim Taleb has written about this. The key aspect of innovation is being in a cluster where you can interact with different smart people and get different ideas. You can't get convergence unless, a biologist meets a physicist and then they say, let's work on this problem. Facts, cell sorting came because Len Herzberg would play ping pong with some physicists. He was in the genetics department, and he said, we started to play ping pong. They said, well, let's develop these labeled antibodies, and that's catapulted the field of immunology forward dramatic, by leaps and bounds.
Mm-hmm. Thank you very much, Alex. That's kind of heartwarming to hear, if you will. Anne or Benjamin, do you want to comment as well?
Yeah, I think the comments were great. It's, I always think about it like, what are the ingredients necessary for that concept, that company to be successful? And I mean, honestly, it's just, are the ingredients, as Alex was saying, are they present in that ecosystem? And the talent that's going to be required, like, does that ecosystem support it? I think New York, each location is different, right? And it's just, is what's going to be needed, and I'll call it the origin story of the company. Is there something that's so fundamental, and to draw those other resources? So I think we've seen certainly there's a number of clusters, and even geographically, Alexandria, you do have Regeneron, you have there's a number of these that are growing in New York. So I would say, just, New York, they just got to keep leaning into that and growing those founder communities that even geographically now are starting to come together.
Right. Deerfield Management is just launching their Cure facility in New York, 800,000 square feet with wet lab space on Park Avenue South, which is really unbelievable for New York City and Manhattan.
Yeah.
So thank you, Anne. Let's move on to some other questions. How do you differentiate between the many T-cell therapy companies that are out there to make an investment decision? And this questioner is, speaking about CAR T, allogenic, CAR T, TLS, autologous T-cell therapies.
Yeah, that's an interesting question. I'm not sure that I've ever framed it that way, just to be fair. So just to kind of do a non-answer to that question, I think depending on the investor, I don't think about how do I compare T-cell companies. So that's not my personal framing, But the type of investing or companies or foundations that I'm interested in is very much grounded in not just, I'd say, like the biology question, but what is the underpinning of those platforms? We've been sort of talking about this convergence. So I kind of think about it like, okay, what is that problem that maybe is driving the team, sort of the mission of the company, vision of the company, and then what is it, the ingredient set that they think they need to work with to accomplish like that mission, that vision. So that's an interesting, because I would sort of put that back to be like, okay, so what type of problem? And it's a generic question, but what's the problem a T cell is going to solve versus an NK cell versus something like what are we trying to solve for in that mission of the company?
Yeah, I think that's kind of so it's obviously, great technology, great space, great, innovation. But right now that's sort of you're asking the question of like, what's a hot area? As opposed to asking the question that we try to ask, what will be a hot area? And what's the next thing to look at? And, we're not investors, but there's a company called Walking Fish, which is trying to do use B cells in the way that T cells have been used. The sort of main T cell investment company we've done is a company called Immunil in India, but their focus is how to make very, very low cost cell therapies for the developing world. It's with Kiran Mazumdar-Shah, who's the great mogul there in the biotech, globally a mogul in biotech industry, and actually Siddhartha Mukherjee is involved, and that's around a vision of a therapy in the U.S. that costs $500,000 is just not going to fly in most of the world. So we need to focus on how do we make this very cheap and very scalable so that people all over the world can benefit from this innovation, and that's the kind of innovation that we did in T cells, basically. There are the engine has I think it's cytopen. We're not investors, but it's a delivery technology for transfection transformation of cells, and those are companies that we look at tooling in the space. So Anne and I are both responding, and that's not the frame that we use to evaluate companies, and I think Ben doesn't either. It's just not how we think about things. I think if you're trying to do the investment in the next set of innovations, you don't say, okay, how do I invest in innovation that's sort of at the cresting wave of excitement? You're trying to be on the other side of it.
Right. I mean, the fact that you don't think of it that way is a really good answer to this specific question. Speaking about regionality, another question came in. What do you think about Europe as a location for investment? And I think, is it Anne? Anne, you have a European investment, don't you, in your portfolio?
We do not, but I'm going to take the crack at it just because in my previous life I was at Sanofi Genzyme. So again, I think about it like there is a lot of great stuff. Like just because France was sort of the place, it was like, I mean, incredible research that's been coming out of those institutes for a long time. So I think there's a lot of opportunity given the quality of the academic enterprise in Europe. And I think growing activity on how to commercialize, how to pull that out of the academic enterprise. So, so generally very exciting, but I would say the same thing. It's like there are definitely strengths of pockets of biology. UK, clearly, I'd say on the computational side, AI, Israel, different technologies, kind of med tech, a whole bunch of strengths, like as you look across that region of the world. And I think a lot of that is capitalization and how to really get the right type of capital to continue to commercialize out of those institutes.
Right. A perennial problem in Europe, capital. Yeah. So anybody else want to add to that, Alex or Benjamin?
We have a whole bunch of investments in Europe. Flow Neurosciences in Sweden, Eligo in Paris, Ochre Bio is in Cambridge. Just a whole bunch. I think that we'll certainly do investments. The barrier is higher though, because it's harder to communicate with them. It's harder for us to help them. It's harder for us to help these companies recruit. It's harder for us to help these companies in lots of the ways that we can help companies. So we sort of, I think the way I think about it is the closer the company is to me physically, the easier it is to make the investment because I can be more active and see what's going on and be helpful. The farther away it is, the harder it is to do that. And that's just the reality. So it's much easier to do an investment at Stanford and not just buy it just because it's right across the street from our offices. It doesn't mean that we think that's any better. It's just easier for us to help in company construction.
Yeah, no, that makes sense. Makes sense. Benjamin, did you want to add anything, or is it?
No, we have kind of we have some limitations in terms of team. We're a small team, so I'm mostly based where I'm in Latin America, but my two partners are in the US, and we tend to look for companies in the US because we wanted to be close to them, even though we now can communicate by Zoom or whatever, but we try to do some things close to where we are, and for the purpose of try to be close to them and help them in any way we can. Yeah.
Okay. Thank you. Kimberly, of course, you can jump in too if you want to when I ask these questions. So, how do you recommend approaching the FDA with AI-enabled medical devices? Do you have AI-enabled medical device companies in your portfolios?
I do. So
okay, I can see that you were getting ready to answer there, Alex.
So again, I don't mean to jump in, but if other people have comments, but there are many paths available, and thinking about it, I would say the challenge is probably not regulatory, fundamentally, but figuring out how you plan to get paid in the space, because the reimbursement and the business model that you want to pursue is really should influence how you think about the regulatory approval process, particularly for devices, because you're not necessarily throwing them out into as products in the way that you think about a drug, but you're often trying to position them in a services industry or sell them to somebody who's going to use them in a particular way. This is a little bit of a non-answer, but it's subtle. I think you should think more about your business model, and that often tells you what your regulatory strategy should be. And you want to make sure that you're positioning your service so that you are able to capture the value that you provide for your business. And there are lots of paths now. There are the NTAP payments that you could get for new technology, particularly AI-driven technology. Biden's put a little bit of a moratorium on that, the breakthrough the process there. I don't know how the reimbursement landscape is going to change. The other thing to also, I guess, the advice I have at our company is this is a great thing to think about too, is don't be reliant on a single reimbursement code or path to monetization, because your whole company can be disrupted if there's just a slight change and your margins change, things like that. Like you can be underwater in a product because of a change in how a code is paid. And so you want to basically plan for that and be flexible and how you think about the business model of whatever you're doing.
Okay, thank you, Alex. And Benjamin, any comments, or should we move on?
That feels like it's a very expert answer.
Yes, it does.
Like, is it implantable? Is it extracorporeal? Is it invasive? Is it, I would say, like, other founders and executive teams that have kind of had to go through a similar path ahead. And I think at this point, there probably are, those that may be ahead of an earlier stage company. I would just use that founder network for suggestions. But general advice, early and often, I've never seen go wrong with regulators, but
right.
Don't listen to a regulatory consultant that tells you not to engage with the regulators. That is the biggest red flag, because for any of these new breakthrough, because sometimes people want to intermediate themselves in the process. For breakthrough areas in new spaces, you have to go engage early and spend, how is this going to be evaluated? And I think CBER is a little bit more innovative than CEDAR, because the drug pathways, for small molecules is like, well trodden, and there's not a ton of innovation lately. But as we move to how clinical trials are designed, there's a lot of interest in synthetic control arms, all kinds of other things. Like, a lot of innovation in regulatory science is happening. But at the end of the day, we need a randomized control trial for most things.
Right.
Yeah.
Okay, here's a really interesting question that's kind of out of the box. Will VCs invest in startup companies that have interesting, innovative technology, but no idea about a product?
I would love to know
what technology.
That question, and like, why? again, it's like interesting technology, like could be the basis of a company, but a company's got to, kind of, it's got to figure.
It is a company. It is a company. And yeah.
That feels like feels like a tricky question, because it's like, but yeah, I mean, at some level, it's like, how do they, what's the mission? I'd be very interested what the mission or the purpose is of that company and how they're what they have.
So we will ask the questioner to provide some more detail on what he is specifically speaking about. So
we're asking questions of the audience now. It's all good, Sarah.
Here's another question. Go. I'm sorry.
No,
go
sorry.
ahead, Alex.
I will add that maybe if it is an interesting technology, and maybe they don't have a specific application right now, but they kind of know how to, or they have a strategy to figure out, like that could be interesting too. Like maybe we can try to solve that. And actually we have invested in those type of companies where we give some money at the beginning just to look around and see what applications we could find. And that sometimes happens when there's a lot of optionality and there's many applications that you can go for.
Yeah, I mean, this is great news for this particular viewer. We'll make sure that there is a connection that is made after the salon is over with. So it's not very often that VCs have great interest in the viewers that are actually, well, I shouldn't say that, investing potentially in the companies that are viewing our session. What would you envision the next up and coming technologies to be that would excite top tier investors like yourselves? And maybe that's a question you can't answer just yet.
Gosh.
Okay, Anne.
There's so much exciting. There's so much like good stuff, but it does. It's some funny equation, right? I think for most early stage investors, it's like, just for the sake of we're getting close-ish to the end. It's like there's this jockey or the horse framework, which is false, because it's not either. It's like, what are you betting on? It's like the total picture of what you're looking at. It's like the founder for us, as with Mo, it's like, what are those founders motivated by? Why are they starting the company? What is the mission of the company? And trying to figure out that total picture of what's going to be driving the reason a company should be built, because we're looking for, from the engine, and I think many of us, what we would refer to as foundational companies. It's the foundation of a new industry. It's a massive enabler of something new in an industry, or it's a disruptor. So, how does that picture all come together when you're looking at, I'm going to say 3 humans who are crazy enough to say they're going to get it done. And do they match what they're outlining as the vision of the company, how they're going to recruit, and how they're going to take this first couple of hops on the journey.
Benjamin, you look like you wanted to add to that.
That's a difficult one. It could be a lot of things, but most of the time the founders help us to figure out, and for sure we look a lot about the founder and how they look at their technology, how they understand the technology, the limitations and the potential of that technology, and how they can think about that technology in the future, and that's something that could be changing the whole time. But they being able to think about it and try to tell you why they think something should be in that perspective, and with strong arguments. I think that is something that we like.
Okay. I think that's pretty much our last question. Alex, did you want to add to that? Because we're up at guest time.
If you're out of time, I guess I would say if there are people that have questions, feel free to tweet at me. because that way, if you have a question that you'd want to ask for an audience, and maybe other people will be interested in the question, I'm the Twitter handle genomicsdoc, and so where you could find me. I think Sarah's tweeted about this event. You can find me and tweet at me, and I'll answer questions.
That's great.
I assume other people do the same.
That's great. So I'd like to give all of you, just an opportunity to say a last word. Kimberly, we'll go with you last since you were a great moderator, and I want you to have the last word. Okay. So, sure. Anne?
Reach out. You're a founder on a mission. Find other founders. Find us. Find great investors who will go with you on your journey to achieve your mission. So excited, Sarah and Kimberly, to have the chance.
Okay, Benjamin. Last word.
Yeah, thanks a lot for the invitation. I really appreciate being here, and feel free to reach out, humboldtfund.com, and we are open to receive any interesting technology with huge optionality and broader applications. Mm-hmm. Thanks.
Great, thank you, Benjamin. Alex.
Echo things that we've said before. There's been a huge change in the world, and coming out of terrible events, that creates lots of opportunity. Lots of large incumbents now are changing business, are vulnerable. This is one of the best times, I think, for starting a company in biotech and healthcare. As the whole business models are changing, technology is changing, and people are open in a way to the use of new technology in a way that they haven't been for decades.
Right, really exciting time. Thank you, Alex. Kimberly, let's go to you, and then I will do a closing, and that's it.
Thanks, Sarah. I just want to say thanks to all the panelists today. It was such a great discussion, and if I can help any of the listeners out there with telling their story, whether it's a startup or a larger company, feel free, like Alex said, to tweet at me. I'm at, you're going to laugh, but I'm at Pharma Prodigy, or you can also find me through Demy-Colton's site. Yeah.
Okay, Pharma Prodigy is great, Kimberly.
Yeah.
That's great. So I do want to thank everybody. Thank you, Kimberly, for putting this group together. It's been a really interesting discussion. An hour is too short. A period of time. I'd also like to thank all of our virtual salon series sponsors once again, and the founding sponsors of BioFuture. We'll talk to all of you about participating in BioFuture when it takes place in New York City. And we'd like to thank our audience for joining us, and please participate in the brief survey that will pop up as you exit. And our next salon is focused on strategic pricing, optimizing product valuation, which will take place on May 20th. Until then, everybody, thank you for joining us today. Goodbye.